Men over 50, if you wake up multiple times at night to urinate, struggle with weak urine flow, or feel constant pressure in your bladder, you're not alone. These symptoms affect millions of men worldwide and often get worse with age. You might think this is just part of getting older, but I'm here to tell you there's hope. What you're experiencing isn't inevitable, and you can take control starting today. The truth is, these problems aren't just about aging or an enlarged prostate. Your pelvic floor muscles, which support your bladder, prostate, and bowel, have likely weakened over time. When these muscles lose their strength, they can't properly support your organs or help control urination. This weakness, combined with prostate inflammation, creates the perfect storm of uncomfortable symptoms that disrupt your daily life and sleep. I'm Dr. Isabel Lopez, a specialist in men's health, and I've helped thousands of men regain control over their bladder function. Today I'm going to share 4 simple exercises that can strengthen your pelvic floor and help manage enlarged prostate symptoms. These exercises require no equipment, can be done anywhere, and take just minutes a day. Before we dive in, I'd love to know where you're watching from, so please comment your city below and follow the channel for more health tips. These aren't just random exercises, they are scientifically proven methods that urologists recommend worldwide. By the end of this video, you'll have a complete routine that can reduce nighttime trips to the bathroom and improve your urine flow. You'll also understand exactly why these exercises work and how to perform them correctly for maximum benefit. But first, let me show you the most powerful exercise that can start working immediately. The Kegel exercise for men is the foundation of pelvic floor strengthening, and it's simpler than you might think. To locate the right muscles, imagine you trying to stop your urine flow midstream or prevent yourself from passing gas. Those muscles you would squeeze are your pelvic floor muscles, and they're exactly what we need to strengthen. Don't worry if you can't feel them clearly at first. This is completely normal and will improve with practice. Here's how to perform a proper male Kegel exercise step by step. Contract those pelvic floor muscles and hold the contraction for 5 seconds, breathing normally throughout. Then release the muscles completely and rest for 5 seconds before repeating. Start with 10 repetitions and gradually work up to 3 sets of 10 throughout the day as your muscles get stronger. The beauty of Kegel exercises is their convenience and privacy. You can do them while sitting at your desk, watching television, driving your car, or even lying in bed. No one around you will know you're exercising, making it easy to fit into your daily routine. The key is consistency rather than intensity, so focus on doing them regularly rather than trying to do too many at once. What makes Kegels so effective is their direct impact on the muscles that control urination and support your prostate. As these muscles strengthen, you'll notice improved bladder control and reduced urgency. Many men see improvements within just a few weeks of consistent practice. Now that you understand the foundation exercise, let me explain exactly why this approach works so well. Your pelvic floor muscles form a hammock-like support system that cradles your bladder, prostate, and rectum. When these muscles are strong and healthy, they provide proper support and help coordinate the complex process of urination. Think of them as the foundation of a house. When the foundation is weak, everything above it becomes unstable and problems develop throughout the structure. As men age, especially after 40, these muscles naturally begin to weaken due to reduced activity levels, hormonal changes, and simple wear and tear. This weakness allows your organs to shift position slightly, putting additional pressure on your prostate and bladder. The result is the frustrating symptoms you experience: reduced urine flow, incomplete bladder emptying, and that constant feeling of needing to urinate. Stick with me until the end because what I'm about to share will complete your understanding of this process. When your pelvic floor muscles are strengthened through targeted exercises, they regain their ability to support your organs properly. This improved support reduces pressure on your prostate and helps your bladder function more efficiently. Urologists worldwide recommend pelvic floor exercises as a first-line treatment for benign prostatic hyperplasia because they address the root cause of many symptoms. The scientific evidence supporting these exercises is overwhelming, with studies showing significant improvement in urinary symptoms for over 70% of men who practice them consistently. Unlike medications that may have side effects, these exercises work with your body's natural mechanisms to restore proper function. The improvements you'll experience aren't temporary fixes, they are lasting changes that come from rebuilding your body's own support system. Ready for the second exercise that will accelerate your progress. The pelvic bridge is a powerhouse exercise that works your entire pelvic region while specifically targeting the muscles that support your prostate. To begin, lie on your back with your knees bent and feet flat on the floor, hip-width apart. Place your arms at your sides for stability, and make sure your spine is in a neutral position. This starting position allows you to focus entirely on the muscles we're targeting without worrying about balance or coordination. Now slowly lift your hips off the ground, creating a straight line from your knees through your hips to your shoulders. As you lift, consciously engage your pelvic floor muscles, the same ones you used in the Kegel exercise. Hold this position for 3 to 5 seconds while breathing normally, then slowly lower your hips back to the starting position. The key is controlled movement rather than speed or height. Aim for 10 to 12 repetitions, focusing on quality over quantity. If you feel any strain in your lower back, you're lifting too high or moving too quickly. The bridge exercise is particularly effective because it strengthens your glutes, hamstrings, and core muscles while directly activating your pelvic floor. This combination provides comprehensive support for your entire pelvic region and improves blood flow to the area. What sets the pelvic bridge apart from other exercises is its ability to work multiple muscle groups simultaneously while maintaining focus on pelvic floor activation. As your glutes and core get stronger, they provide better support for your pelvic organs, reducing the workload on your already strained muscles. Regular practice of this exercise helps normalize pressure distribution throughout your pelvis, which can significantly reduce prostate-related discomfort. But we're not stopping here. The third exercise takes a different approach that you'll find surprisingly effective. Light squats might seem like a basic exercise, but they are incredibly effective for improving pelvic health when performed correctly. The key word here is light. We're focusing on controlled movement and proper form rather than heavy resistance or deep squats. Stand with your feet shoulder-width apart, toes pointing slightly outward, and your weight evenly distributed across both feet. Keep your chest up and your core engaged as you prepare to move. Lower yourself slowly as if sitting back into a chair, keeping your knees aligned over your toes. Descend only as far as feels comfortable. Typically just above chair height is perfect for our purposes. As you squat down, consciously engage your pelvic floor muscles, then maintain that engagement as you slowly return to standing. The entire movement should be smooth and controlled, taking about 3 seconds down and 3 seconds up. Perform 8 to 10 repetitions, focusing on the connection between your leg muscles and your pelvic floor. This exercise is particularly beneficial because squatting naturally activates your pelvic floor muscles while improving blood circulation throughout your pelvic region. Better blood flow means better oxygen and nutrient delivery to your prostate and surrounding tissues, which supports healing and reduces inflammation. The beauty of light squats lies in their functional nature. They mimic movements you do every day, like getting up from a chair or picking something up. By strengthening these movement patterns with conscious pelvic floor engagement, you're training your body to automatically support your prostate during daily activities. This unconscious activation throughout the day provides continuous benefit beyond your exercise sessions. Now let me share the fourth exercise that works differently from the others but is equally important. Diaphragmatic breathing is the secret weapon that many men overlook, yet it's incredibly powerful for prostate health. This type of breathing directly influences your pelvic floor muscles through the connection between your diaphragm and pelvic floor. When you breathe correctly, your diaphragm and pelvic floor work together like a coordinated team, creating optimal pressure and support throughout your core. Most people breathe shallowly into their chest, missing this important connection entirely. To practice diaphragmatic breathing, sit comfortably or lie down with one hand on your chest and one on your abdomen. As you breathe in slowly through your nose, focus on expanding your belly rather than lifting your chest. Your bottom hand should rise while your top hand remains relatively still. This expansion gently activates and relaxes your pelvic floor muscles in their natural rhythm, promoting better function and reducing tension. Breathe in for 4 counts, hold gently for 2 counts, then exhale slowly for 6 counts. During the exhale, allow your pelvic floor muscles to naturally engage as your diaphragm rises. This isn't forced contraction like the Kegel exercise, but rather a gentle, natural activation that occurs with proper breathing. Practice this for 5 to 10 minutes daily, ideally before bedtime to promote relaxation and better sleep. This breathing technique is particularly effective because chronic tension in your pelvic area can actually worsen prostate symptoms. When you're stressed or anxious, these muscles tend to stay tight, creating additional pressure on your prostate and bladder. Diaphragmatic breathing helps break this cycle of tension, allowing your muscles to function normally and reducing the constant pressure that contributes to urinary problems. The relaxation effect can significantly improve your nighttime symptoms and overall comfort. These 4 exercises work together to create comprehensive support for your prostate health. Join the Members Club. Drop a super like on this video if it's helping you understand how to take control of your prostate health naturally. What we've covered today isn't just theory. These 4 simple exercises represent a practical, proven approach to managing enlarged prostate symptoms from the comfort of your home. You now have a complete toolkit that addresses the root cause of many urinary problems rather than just masking symptoms. The power to improve your quality of life is literally in your hands. The beauty of this approach lies in its simplicity and accessibility. You don't need expensive equipment, gym memberships, or complicated routines that you'll abandon after a few weeks. These exercises can be seamlessly integrated into your existing daily routine, whether you're watching television, working at your desk, or preparing for bed. Consistency matters more than perfection, so even 10 minutes a day can make a meaningful difference in how you feel and function. Remember that your body responds to what you do consistently, not what you do occasionally. Start with just 1 or 2 exercises and gradually build your routine as these movements become natural habits. Many men notice improvements in their symptoms within 2 to 4 weeks of regular practice. Some experience better sleep within the first week as their nighttime urgency decreases and their bladder control improves. Your prostate health doesn't have to decline with age, and you don't have to accept uncomfortable symptoms as inevitable. These exercises give you an active role in your health management, empowering you to make positive changes that compound over time. Strengthen your pelvic floor with these simple movements and see the difference in just a few weeks. Your body is designed to heal and adapt. Give it the support it needs through these targeted exercises and consistent practice.